Welcome, and thank you for attending my presentation. Today we will see an introduction of the Millen Clinical Multi-Axial Inventory 3, in short the MCMI III, and the Minnesota Multiphasic Personality Inventory 2, in short the MMPI-2. The purpose of the MCMI III is to provide information of treatment to the region of personality disorders and clinical syndromes. Mostly implemented in clinical settings, it is used with those individuals who necessitate mental health services for emotional difficulties, interpersonal difficulties, and social issues. The MCMI-3 addresses a clinical population of adults, ages 18 and above, with a reading ability of grade 8. And there are 28 clinical scales, of which 4 score personalities, 11 score clinical personality patterns, 3 score severe personality pathology, 7 score clinical syndromes, and 3 score severe clinical syndromes. The authors are Theodore Millen, Roger Davis, Carrie Millen, and Seth Grossman. The publisher is NCS Pearson, and the copyright date 1994. This introduction entails the MCMI-3, however there are previous versions available, which are the MCMI-1 and the MCMI-2. The MCMI-3 is available in standardized self-report questionnaire, on paper as well as on computer. The assessment questions are in true and false order. With 175 test items, it addresses a wide range of issues relative to personality, emotions, and attitude. The changes made from the MCMI-2 to the MCMI-3 include 90 new items that deal with the severity of symptoms to increase ability in detecting pathological issues. Instructions to the test are brief, and administering as well as scoring is simple with the multi-axial format. We now look at the scales of the MCMI-3, which consists of 14 personality scales and 10 clinical syndrome scales, as well as 5 test attitude scales that are broken down as follows. The moderate personality disorder scales consist of schizoid, avoidant, depressive, dependent, histrionic, antisocial, aggressive or sadistic, compulsive, passive-aggressive, and self-defeating. The personality pathology scales consist of schizotypal, borderline, and paranoid. The moderate clinical syndrome scales consist of anxiety, somatoform, bipolar manic, dysthymia, alcohol dependency, drug dependency, and post-traumatic stress disorder. The severe syndrome scales consist of thoughts disorder, major depression, and delusional disorder. The 5 scales detect careless, confused, and random responses that are rendered by the test taker on the test. The base rate scores depend on how the individuals respond to the test items. A score between 75 and 84 indicates substantial personality or mental health problems. If scores are higher than 85, they indicate persistent and substantial clinical concerns or personality disorders. Now let's look at the norms of the MCMI-3. It was normed with a group of psychiatric patients. In addition, the MCMI-3 uses a weighted score with the base rate that takes into consideration the prevalence of this population's disorders. Based completely on clinical samples, the scores apply only to those individuals who are evidencing problems with emotional and interpersonal symptoms. Also, this population must be under psychotherapy or professional psychodiagnostic evaluation. Further, the validity. Several correlations, for instance, have been distinguished between the MCMI III and other instruments about validity, and many correlate with the MCMI III. High correlations were found between the MMPI-2 and the MMPI-3 in relation to the MCMI-3 with major depression at 0.71 and dysthymia at 0.68. In an article, for instance, of a child custody case, the MCMI-3 was used in a normative study. Validity for forensics evaluations was supported in using the MCMI-3. However, validations by the DSM-IV and legal criteria was studied and found poor convergent and discriminant validity. On the other hand, a study of loss data and computer score protocols showed that scores were valid, as a raw score of 0 and a scale X raw scores were within the acceptable range of defined in the test manual. Reliability with an internal consistency measures are strong for the MCMI-3, with the alpha coefficients exceeding 0.80 within 20 of the 26 scales. Depression measured at 0.90, whereas the compulsive scale measured at 0.66. Reliability for test-retest at intervals of 5 to 14 days measured high at 0.91. This picture allows us to take a closer look at base rates of the MCMI-3, where we can see cutoff rates as shown. Base cutoff rates are at 60 for the median, 75 for significance, and 85 for prominence. The yellow text inserted shows us that most adults appear narcissistic. However, it also shows the importance of considering all scores and not only a few scores when interpreting the scores for results of the test. This picture gives us a great example of the MCMI-3 scoring. It also shows the measure of each item, and after scoring, a capsule summary is provided, which gives interpretation considerations and possible diagnoses. It also gives therapeutic considerations. Included as well is the Grossman Facet Scale of the MCMI-3, which indicates response in tendencies, personality patterns, and clinical syndromes, as well as DSM-IV multi-axis diagnoses. With this, we are concluded with the MCMI-3. Thank you. Now let us discuss the Minnesota Multiphasic Personality Inventory 2. The MMPI-2 assesses psychopathological issues in adults with a minimum reading level of 5th grade. As a broad-based test, the MMPI-2 assesses numerous major personality patterns that relate to emotional and behavioral disorders. It consists of 563 true and false items and takes approximately 40 to 90 minutes to administer as a self-report test. The MMPI-2 is used with a norms group in clinical as well as non-clinical settings, and in non-clinical settings, it assesses the personality of individuals in a high-risk public safety position. High-risk public safety positions such as police, firefighters, nuclear power workers, criminal and civil forensics, air traffic control, and pilots. The authors are Stark Hathaway and J. Charnley McKinley. The publisher is the University of Minnesota Press, and the copyright date of the MMPI-2 is 1989, with a revision in 2001 and updates in 2003 as well as 2006. The MMPI-2 is a standardized self-test and is available in several forms, such as on computer, CD, and in paper and pencil. The MMPI-2 is scored in subunits made up of 8 clinical scales to provide clinical profiles. These scales are termed as hypochondriasis, depression, hysteria, psychopathic deviant, masculinity and femininity, paranoia, psychasthenia, schizophrenia, hypomania, and social introversion, which was added. Additionally, 3 scales that are added identify validity of the clinical profile. These are L for lie, F for infrequency, and K. These scales measure statements that deal with common, fairly immaterial weaknesses to which individuals often are not willing to admit. They also will detect those that try to hide actual psychopathology. Each of the mentioned scale scores also provide treatment suggestions. The scales mentioned in the previous slide measure general dissatisfaction, issues related to pain that can cause depression, beliefs of badness, family problems, and substance abuse, anxiety, irritability, anger, oversensitivity, thought process, aggression, and grandiosity. Samples of scores based on gender differences show that there's not much difference in the score. However, when considering ethnic differences, it is vital to select culture-related items in the test questions. The manuals of the MMPI-2 are created to show the reliability, as well as standard errors related to the scales of the MMPI-2. 193 individuals of the normative sample tested twice within 1 week with the test-retest correlations ranging between 0.54 and 0.93, with most correlations ranging at 0.70 or higher. On the other hand, T-score values ranged between 2.65 and 6.71, of which most ranged below 5.0 in non-clinical settings. The validity shows to be valid in overall measurements in clinical as well as non-clinical settings. In studies that are predictive of numerous aspects such as violent behaviors, the MMPI-2 shows to be an effective instrument of measure. In an article of the MMPI-2, for instance, being used with Asian populations, it was noted that this test is widely adapted into multiple languages and cultures globally. The article also examines the use of the MMPI-2 as how effective, how reliable, and valid the assessment is across multicultures. In this picture, we can see a mean profile of the MMPI-2 of its rating report for validity, the clinical content, and the supplementary scales. It shows a clear picture in graph as well as numbers. This image allows us to get an idea of the F, the L, and K scales. If you remember, those are the scales that measure and assess the validity of the test taker, such as the test taker's responses and faking responses. Here we can see how the test arrives at the mean differences. The next slide invites you to look at the resources by reference who contributed to this presentation either by graphic or data. And this brings us to an end of the introduction of the MCMI III and the MMPI-2. I want to thank everyone who came to my presentation. If there's any further question, please feel free to contact me. You also may take contact information on your way out. Thank you. Bye-bye.